Graduate of Sherman College of Stride Chiropractic Care in South Carolina, USA, and has served in both the public and private health sectors, both locally and internationally. Dr. Stower is the founder and the CEO of Polycare Wellness Center, a renowned healthcare provider in the country with state-of-the-art clinics located in Lavington and Nyari. Under her leadership, these clinics are staffed by a multidisciplinary team that includes chiropractors, physiotherapists, sports therapists, hydrotherapists, and acupuncturists, among others, delivering comprehensive wellness care to the community. Her commitment to service extends beyond healthcare. She's an active member of various local and international charitable organizations dedicated to supporting disadvantaged communities, including Lions Club International, American Women's Association, East African Women's League, and the Rotary Club of Modaiga. Dr. Stower is also a passionate communicator and leader. She's a proud Toastmaster and a member of Business Network International. Ladies and gentlemen, this Power Monday morning, I give you Dr. Margaret Stower.
Thank you. Thank you so much, June, for that nice introduction. When I was listening to it, I didn't know that I was listening to me being introduced, but thank you, June. One of the things that I am so happy about is to really have this platform. Thank you so much, Dr. Melvin, for inviting me on board. And it's good to see your Tieno, and it's good to see my team here. Thank you for being here. And I must say, it's an honor to just talk to you about what we do and where we are at. Healthcare is changing over the years. I do remember when we were young and, we used to go to the doctors, and there was a certain doctor, an Indian doctor, who used to give us water of injection because people needed to get injected, even if it was not medicine, but he knew that you don't need medicine, you just needed assurance that you're being given something. So he used to inject his patients with water of injection because they wanted an injection, they wanted something. But I'm here to talk about chiropractic, and I'm here to talk about wellness. And I know we have a lot of people in this space of wellness, and we just need to share and collaborate on what we do. So let me just share my screen. Okay, so we're going to talk about how the spine and the nervous system work together. One of the things that I didn't tell you is I used to be a physical therapist at Nairobi Hospital, and I've worked in the public sector, I've worked in the private sector as well. And one of the things that I realized is most of my patients were going out to see the chiropractor. And at that particular time, the chiropractor was in Hurlingham. There were 3 of them at Hurlingham area, and the patients would go in and see the chiropractors. Then they'd come in for physiotherapy, and they'll tell me all about chiropractic and how it has helped them. So I was curious to find out what is chiropractic. At this particular time, I had no idea what chiropractic is all about. So being curious, being young, I went in and saw one of the chiropractors who I said, well, my patients come to you and they have this results. But she was very nice. She was called Dr. Ndeko. I wish I had invited her for this platform, but she was very, very nice. And she told me, no, come in, let's do this together. We need more chiropractors here. So at that particular time, I took 3 weeks leave from Nairobi Hospital just to observe and see what she was doing for the patients because they were getting such good results. But she told me, no, you have to go to school. So I had to quit my job and go in and do chiropractic. So I went to the US, did 5-year program and came back to Kenya to set up Polycare. So when you're looking at the spine and the nervous system, we know that the spine and the nervous system work together. So we know that the spine is a stack of bones, but that it's not just bones. It's really a protective housing from one of the most important parts of our body. So one of the things that form when we are young, so you have the sperm and the ovum and they form a zygote. So the first thing that really forms is a nervous system. It's the brain and the nervous tissue that really develops when a child is forming. That's the first organ that forms in our body. So this brain and the spinal cord is housed in the vertebral column. So the brain is really the control center of every function in our body. The spinal cord is a communication pathway where there's communication between the brain and the rest of the body. So we have nerves that branch out on every part of the vertebral column, going to every organ, every muscle, and every tissue. So if your spine is healthy, it allows the nerves to organs to work without interference, meaning messages from the brain can travel freely and act accurately. So why does this matter for health? It matters because this nervous system, as I said, controls and coordinates everything on the body, from the heartbeat to your digestion, from your immune response to your balance. So when signals are blocked or altered, your body may not respond well to stress, to injury, or illness. So a healthy spine equals a clear nerve pathway, of course, efficient communication. Likewise, an unhealthy spine means your body is compressed, there are misaligned areas, and you may be distorted, and there are also blocked systems. So it's really a chain reaction. So let's imagine your spine is misaligned or stiff. The nerves get irritated or pinched, and the communication between your brain and your body parts become less. This leads to pain, to muscle weakness, to slower healing. It can cause organ dysfunction and chronic tension. On the other hand, the chain reaction, on the flip side, with a well-aligned mobile spine, your nervous system operates efficiently, the reflexes, balance, and movements are smooth, the organs receive proper signals for optimal function, and your body can heal and adapt more effectively. So let's look at it like a foundation analogy. So your nervous system is really your electrical wiring in the body, and your spine is the main conduit that protects the wiring. So if the wiring is faulty or the conduit is damaged, the whole house suffers, even if the damage is hidden. So you may not be functioning very well, like a damaged house, but you're still there without realizing what is going on in your body. So chiropractic and overall wellness. That is why chiropractic offers focus on spinal alignment. It is not just to relieve back pain as it's commonly known, but we ensure that the nervous system can function without interference, supporting better energy organ function, posture, and resilience. So in conclusion, a healthy spine keeps your nervous system healthy. A healthy spine keeps your nervous system healthy. And your whole body is coordinated, responsive, and adaptable. So together they create the foundation on which all aspects of health rest, from immune strength to emotional well-being. You know, I do recall that there was a doctor of, not even a doctor, he was Thomas Edison. He was an inventor way back in the 19th century. And he did say that the doctor of the future will not give any medicine, but will interest his patients in the care of the spine, in diet, and in exercise. So he had some foresight to the doctors that we are seeing today. We have a lot of doctors who are in the wellness space. We have functional medicine doctors. We have the dietitians. We have the reflexologists, like you had last time, and all the people who are doing a lot of nutritional health. So wellness is changing, and chiropractic is one of the branches. I wanted to be very general today so that I can get your questions, and then we can have answers to them. We are located in Lavington Green Shopping Mall as well as Nyari, and then we opened up Jaroram at Jaroram Hospital in Nakuru. So I'm done. Thank you so much for being an attentive audience. And now I think we'll take questions. And we'll go ahead.
Thank you very much, Doctor. One, I like the fact that you started, you were introduced as a Rotarian. I'm also a Rotarian, and I see lots of Rotarians logged in here. I belong to the Rotary Club of Milimani. Number two, I heard that I heard you mention that people would be injected even with water. I have a lot of stories and experience from that. My uncle has been a clinician for over 40 years, and for many times people would go to him just because they believe in him. So gives them simple medicine to work, but because some people really believe that they've got to be injected, if he invents something to inject them, water, whatever, yes, so that they feel they are getting healed, and they get healed. Now, a few questions have come up, but maybe starting with there was a mention of electrical energy, whatever, nerve system, things like that. How does it relate to also what we learned last week, reflexology? Do they work together? Is one a supplement of the other, or a replacement, a substitute of the other? And then somebody has also asked, that is Dr. Gilda Odeira, who is also a member of my Rotary Club, by the way. Let me say that just to brag. She's asking, could you talk a little bit more about spine and immunity? Yeah.
Thank you so much for those questions. I put up this one. Reflexology, and I'll take the first question. Reflexology and chiropractic are very well connected. We all have different pathways to the same house. It's like when you have different doors going into the same house. So you could use reflexology to hit onto the nervous system, as well as chiropractic to open up the vertebral column so that you can get better flow. Chiropractic works on alignment of the spine, because we know that nerves, as I explained earlier, come from the brain going through the spinal vertebra, and then projecting themselves into the organs. So if you have a kink in the spine, you need to adjust it, and then you get better flow. Reflexology works on the meridian and the pain points on the pathway of pain, and the nerves per se. So we have two conduits on the nerve itself. There's the sensory part and the motor part. So reflexology has a way of touching those pain points or the meridians where you can get good nervous flow. So to answer that question, they work in the same way in the fact that there are different doors into this particular system. The other question was to talk more on the spine, was it? Could you repeat it?
The relationship between spine and immunity.
Spine and immunity. Excellent. Good question. Yes, the immune system, the body is so complex. When you look at the Bible and the a verse that says we are wonderfully and wholesomely made. We are fearfully made. I'm not so sure I'm quoting it correct, but we have all this system. We have the chemical balance in the body, the immune system, and the spine per se. So we all work together. Opening up the spine also enhances your immune system in the fact that there are areas of the nerve of the vertebral column that works with the immune system as well. So if you adjust the spine, you're also enhancing your body as a whole.
Okay, great. Thank you. Thank you very much. Uh, Somebody has asked whether this is the same or it's related to acupuncture.
Aha, good question. Now, when I began our presentation this morning, we talked about various therapies that are in the wellness space: acupuncture, chiropractic, reflexology, all work on the same system. We have a focus such that chiropractors are focusing on the spine of the vertebra itself, the nervous system. Acupuncture would be focusing a lot on the meridians. And I'm sure there's one person here who will talk to you about acupuncture very well. So it's very wholesome, the fact that even the immune system gets enhanced with a good flow of nervous system in the body.
Great. Actually, that was Maina Muturi, also a past president for our club. And Gilda is also a past president of our club. Thank you very much. Now, just there are questions which I'm going to read. Is this, I want to ask this way. Who exactly comes to you? Is it somebody who is sick or somebody who is well and wants to keep well? And is it diagnostic? Do you diagnose what is your problem? Or they come when they know their problem, or they don't need to know have a problem?
I like those questions. I made this presentation general so that it's not like, okay, I have back pain, I have knee pain, I have hip pain, let me do about it. We like, and I've been talking to Kenyans ever since I came back, that you don't have to be sick. Healthcare is all about preventative. So let us take care of our body while we can before things get worse. Let us stop that chain reaction, because one day you'll have that pain here and the body is so intelligent, it says, it recruits other parts of the body like, oh, come in and help. So the whole system kind of breaks down just because of a small thing that you would be able to prevent. So the question is, do you have to be healthy in order to come in? No, we like seeing you before you get unhealthy. But if you're sick, we can also help you. So we work in the fact that we like preventative care. The module of healthcare, especially conventional medicine, has been, if you're sick, then you go see a doctor. Why not go see the doctor before you get sick?
Okay, fantastic. So Olembo has asked, can a patient be handled by reflexology at the same time with chiropractic treatment, or is one superior than the other? I know a very interesting question there. You may not want to speak much. Okay, what do you say?
I would say that one is not superior to the other. All healthcare should work together to complement each other and to be able to give the best to that particular patient. There are other areas that you may find that, this works more. And I must say that reflexology would work a lot with autoimmune things that people can't put a diagnosis on. There are times when you have a problem and you'd go through all the blood tests, all the x-rays, and everybody says, oh, there's nothing wrong with you. The doctors will tell you there's nothing wrong. But you as a patient know that you are the one who's feeling the pain or who's feeling the discomfort. And then you try out non-conventional medicine, alternative healthcare things. And the first thing that I'd probably recommend is really go see the reflexologist, see whether they can open up your meridians and earth you well. And then, of course, look at your spine and see whether there's any blockages in the vertebral column. So, yeah, we combine our treatments together. And at Polycare, we do have chiropractors, acupuncturists, we have yoga, have hydrotherapy. So it's a really wholesome clinic. Holistic approach to healthcare is the best way to go.
Beautiful. How, that is from Dr. Melvin himself. How prevalent is cervicovertebral misalignment in Kenya, given that people are always bending down to look at their phones and laptops? Are there special manipulations a chiropractor can perform for the neck pain and stiffness? Yes, that is the question. And maybe on that, is there a preventive, whatever you would you would recommend for people not to reach that level where it's now painful?
Yeah, this is very, very, very common, especially in the young people, because we are always, engaging with our gadgets. I'm sure if you don't look at your phone every second, you'll probably be a little bit nervous that there's something going on that you don't know about. So we are always engaging with our gadgets. We're always on the phone. We're always on the laptops. We're always doing things to do with gadgets. So it's very, very common. Neck pain, particularly in the cervical region. The cervical is really the neck. So we have 7 vertebrae. From the first one in the first column called the atlas to the last one called the, I'm looking for the spine so that we can point it as we go ahead, to the last one called the tailbone. But you asked about the neck. So yes, the necks are very, 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 the neck is very common because of what we do and how we engage. So lots of tension in the neck area because of the way you sit, the way you stand, the way you engage with your phone. So we adjust the spinal column at the neck area to make sure that things don't go badly. And then we advise you on the type of exercises to stabilize that and ergonomics to change the way you do your stuff. I'm still looking for that, excuse me for a minute, for that vertebral column so that you can look at it and see. But anyway, this area is very, very common in most people because the neck starts hurting, then it recruits the muscles of the shoulders, and you have these muscles at the shoulders that attach from the shoulder to the neck region. There's a big muscle called the trapezius that originates from the shoulder and attaches into the neck. So if there's a problem here, it recruits that muscle and the muscle comes tight, and then you start rounding your posture, start pulling yourself forward, which is not good posture. And of course, then you have the TMJ is the jaw, starts getting a little bit stiff and tight. So you may have someone who grinds at night and yet it just started from the neck area and everything else is, flowing up around this area. So yeah, this is very common in young people. So we need to make sure that we are sitting upright, using our phones and our gadgets properly so that we don't get stress in the neck and the shoulders.
Great. Thank you. Thank you. Then there is another question from Dr. Peter Hayombe. What could be the cause of numbness of a part of the body? Numbness, sorry. What could be the cause of numbness of a part of the body where then the individual does not feel the pain? There is a numbness in a particular part of the body, you don't feel the pain. Maybe you can put it in fire and it's not burning.
Various things. When there is numbness, there could be systematically, like in the case of diabetes, when you have numbness in the feet because your blood sugars are very high, and of course, you're not producing insulin. So that could be a cause of numbness, particularly in the feet. It could also be functional. So what I'm saying, it could be a chemical reaction, or it could be functional. If it's functional, it's really an impingement in the vertebral column where the nerves are impinged. And then, of course, when they're impinged, the sensory part of it you can't feel. You can't feel it, but you feel numb. So it's really impingement. It's really like when you sit on badly in a place, and then when you get up, you feel that pains and needles or numbness in the feet. So that happens on the vertebral column. And if it happens, then you have to look at where is the impingement on the column, and then you can adjust your spine appropriately.
Talking about pinching
I hope I've answered that.
talking about pinching, now that you talked about it, somebody had also asked, that is Dr. Kezia, what happens when there is a pinched nerve in the spine causing pain? Is it curable? So I don't know what that means now that you're talking about pinch. What does it mean? Because what some of us ordinary people know about pinching is somebody pinches your body or something. So how it reaches the spine getting pinched, what does that mean?
It's a good question, Otieno. It's really simple. The body is three-dimensional. We flex, so we are moving forward, we are moving back, extension. That is the frontal plane. Then there's the sagittal plane where you're moving side to side. And then there's the axial plane where you rotate your neck. So pinchment happens in the vertebral column when those vertebrae are, because of a movement, they get kind of stuck in one place, and then they pinch the nerves that go around that area. So the muscles pull and everything gets stuck there, and then it pinches onto the nerve. That's the functional part of pinchment that we talk about when we are talking about the nervous system. There's an impingement in the nerve.
Okay, so she was asking what happens when there is a pinched nerve in the spine causing pain. Is it curable?
What happens when there's a pinched nerve in the spine causing pain? The whole concept is to unpinch it because if it's pinched, it's really functional. It is something that can be corrected by a little adjustment or looking at it. One of the things that we didn't talk about is the fact that if the pain is so intense or the numbness is such that you can't really move, of course, you need to go for radiographic examinations. You need to look at the images to see how bad that place is. So there's a whole range of impingement or disc stuff that would happen in the spine, like a disc will be compressed because of the things that we've been doing. And then you need to really evaluate and see. So chiropractors are actually trained to diagnose and evaluate the particular person. And of course, we coordinate with the other doctors. So you may call in for images. You may say, okay, this is something that cannot be done functionally, and you need to go for surgery, or you need to consult the orthopedic doctors to see what else can be helped on. So it's not just a matter of adjusting, it's a matter of diagnosing properly, it's a matter of consulting with other providers, with other doctors to make sure that your spine is healthy.
Wow, okay. Unpinched. Good. Dr. Eda is asking, please explain I don't know how to read this, Nuga Beast or Naga Best therapy for spinal alignment. That's here in Kenya. That beast or best. The Nuga Best
Very
therapy.
good. I'm liking this this platform. Nuga Best. Yes, Nuga Best. Yes, these are beds that are formulated to massage the body. And the way they do it is they're going through the vertebral column, like that and massaging it right from the beginning to the end. It's a nice bed. It's a nice feeling. It's a real good massage. But I tell people that you need this because you'll just be spreading your infection right throughout the system. So as much as they help relieve the tension in the muscle and the pain, it is not something that I would advocate for anybody to just go there without knowing what is the real cause of your pain.
Okay. I don't know
So
whether
proper
yes.
diagnosis, kind of cautious about gadgets as you use them.
Okay. Thank you. Thank you very much. Next is Flo Ambayo, Dr. Florence. Thanks, Dr. Margaret, for your talk. I missed a better part. Okay, you may not have missed much. She was very brief to the point, like a miniskirt, they say. Would you like, would you like to say something about how we are spending our time bent on phones and laptops? What will happen, especially to our young children growing up with necks misaligned and backbone?
Good question. Just the other day, I had a 13-year-old coming in with neck pain, and the dad said, "Oh well, they're always engaging on these days. They watch YouTube videos, and they're always doing some stuff." We really must engage our youth, especially the young ones, by teaching them proper dynamics, proper care. When I was going to school, them days, we used to have what we called PE, like physical exercise. So you go out and stretch and do things. We didn't have gadgets. So we really didn't complain of neck, back problems. But these days, you're seeing young people coming in with neck problems, backache, just because of poor posture. So my appeal is for parents out there to look at their children, look at the way they're developing their spine. I was privileged to work a little bit in the States, and there was this kind of thing that schools used to have chiropractors come in to do a spinal check. It was part of the school program where you have your parent and the child, and the chiropractor would check and see, oh, is this spine developing very well? Because one of the things that people miss and parents miss is that curvature that develops. If you look at the spine, and we're just visualizing it right now, it is like a tree that is growing up. So if the spine is developing, a child from the first time he's born, the bones are really developing. So you want to make sure that that bone develops in a good structure. So I will ask parents, young parents, to evaluate their children, especially girls at a certain age, at age 5, 6, they say, oh, I don't want to be bathed by you. I don't want to be, just tell the child, I want to see how you are. Most of these things are detected when the children are being bathed, and you can see, ooh, this doesn't look quite normal. Because when they're dressed, you won't even notice that spine going in a different direction. So it's important to have a look and see how your children's spine is developing, because these days they're engaging a lot on phones. We're giving kids phones even at a very early age. A 1-year-old with a phone, a 2-year-old with a phone, entertaining themselves, but it is not good for their structure.
Okay, good to hear that. How can one, that is from Dr. Gilda, how can one reverse osteoporosis of the spine through chiropractic sessions?
Nice. Osteoporosis of the spine reversal. Chiropractic will enhance the healing process, but they probably want to see, do their bone scans to see how bad the osteoporosis is. They may need supplementation, you may need to do things differently. You may need some weight-bearing exercises to build up bone mass. So chiropractors are trained to point you in the right direction. And, you know, for osteoporosis, we have a little gadget that we use for adjustment. So we're not doing a physical adjustment with our hands, but we're using a little, we call it, it's a little tool called an activator. So we will activate the spine, but the whole concept is to look at you holistically and say, okay, maybe you need supplementation here, maybe you need to do things differently, maybe you need to exercise the right exercises. And yep, that's it.
Okay. Oh, fantastic. Great. Thank you very much. Yes, Dr. Gilda has given you a thumbs up. Now, June herself, the person, the lady, the lovely lady who introduced you, is asking. She's also in wellness and nutrition. Amazing. And thank you for leaving more time for questions. Any comment, please, on the myriad cases of knee and hip replacements in Kenya, in people, especially ladies of young age?
Good question. I haven't seen a knee replacement in a young person in Kenya. I would say, if they're
I,
there,
I inserted Kenya, I think, because it was in my mind. But in her question, there is no Kenya.
I know if you go for a knee, because sometimes you could get a hip replacement, knee replacement when you're young because of the dynamics of that hip. But yeah, if you do, it is well because it needed to be replaced. But remember that anything foreign that's going to the body, it will have to be also, after some time, it goes under wear and tear. So that young person may have to undergo another surgery 10 days to come, or not 10 days, but 10 years to come again, because the joint has worn off. Yeah, I could say that surgeries are becoming more for lack of a better word, advanced in the fact that you could do something about that joint earlier rather than later. And of course, if you do, then you know that it's going to be a repetitive surgery 10 years to come because of the aging process of the system.
Yes, then somebody here has asked Olembo, kindly put your contacts, share your contacts. I know they were on a slide somewhere, but I know they can also be shared. But if you, uh, I know maybe Brenda will put them in the chat as you,
She will.
you also, yes. Then there is Eric Obwaka, is also a Rotarian and NBI, you know, is it BNI member. Dr. Stower has been my doctor for that last 4 years. Oh, and I got healed from a terrible back issue. She's professional and reliable on pains, back pains, discomfort, injuries, and there were 2 thumbs up there. Okay, that was a comment. Then there is Nancy Gadinji, who asks, kindly talk about the relationship between massage, reflexology, and chiropractic. I know you mentioned, you had talked about this, and I don't know whether you want to make one comment about it as we
Yes,
go on. Yes.
I will. Talk about the relationship between massage, reflexology, and chiropractic, in the fact that we all work on the musculoskeletal system of the body. So musculoskeletal system is the muscles and the skeleton. But tell you what, if you go for one and not the other, then you're not doing yourself justice. Because if you work with massage, yes, you relieve that pain for that particular moment. The muscles relax. But remember, those muscles are attached onto the vertebra through the tendon, and then the ligaments that attach the bone to bone. So you need to make sure that you have aligned that system. If, for example, you're bending forward and you twist and there's back pain, don't go rushing to where massage would help relieve that pain immediately, but that particular area needs to be aligned. Because in my experience, I've had a lot of people saying, oh, I've gone in for massage, but it didn't go away. It relieved it for a while, and then it's still hurting. It's because that spine was not aligned properly. When it comes to reflexology, as I said, works a lot on chronic issues, and it opens up the meridian. The body has meridians in the system whereby we are all a group of ions. We are all made out of ions, and we need to be grounded properly. So the whole therapies work together. Chiropractors work on alignment of the spine, they adjust them, and then they enhance the nervous flow into the system.
Thank you very much. Yes, people who are joining, people may be asking, how is Live Your Dream getting into health space? We are not in health space, of course. We just know that for you to live your dream, building your business, you need to be healthy. And so if for your business related problems, that is where Live Your Dream will come in. They're very informative. That is from your friend Alice Ngige. Very informative session, Dr. Stower. This is well articulated. Then from Odhiambo Lale, a member of this particular team, Power Monday board, he says, prevention is better than cure. What are your thoughts on swimming, walking, cycling, mountaineering, and yoga? Yeah, I know he's a walker. He takes a walk every morning, so he wants to be assured that he's on the right track.
He is on the right track. The body is designed to move. Every time we sit, we are not doing ourselves justice. We are designed to move. We are designed to do stuff. We have muscles that need to build up. We have joints that need to move. So being healthy is really a part of exercises. So exercise, move. I like the fact that he's hiking because I'm an advert hiker. I like the fact that he's swimming. Swimming is really good for the joints because it lessens the load on the joints. So you swim, you're not stressing your body.
Okay, I'm not so sure about swimming part, but I'm sure he walks and he moves in the forests. Thank you. Next, well, for the participants, thank you for joining. I've also put there two links. One is for YouTube subscription. I know some of you log in late. We have had up to 95 people. So you can always follow this afterwards. We try to post it on YouTube by Wednesday. I've also put there a link through which you can fill in and join our Power Monday WhatsApp group, and so that you continue being in communication and on the loop. And the other thing is, I'd also posted about our upcoming dinner, which is the last Friday of October 31st, and you are all welcome to join so that we can interact one-on-one. It is in Nairobi for people who can make it to Nairobi if you are away. Then next we have somebody asking how much consultation. How much is consultation? Maybe that one also needs to be. Yeah, you can mention it. How much is consultation? Do we
Thank
need
you so
an arm
much.
and a leg? An arm and a leg.
I have lowered my hand because I was just about to say we have a 10% discount on everybody who's listening here if they come to us before the end of October. So we have 2 months, September and October, 10% off. Our consultation and our treatments is 6,000 per hour, and it could run to an hour and 15 minutes. So it is expensive, but it's worth the investment. And for today, anybody wants to come in before end of October, we have a 10% discount. And my team is here. Just say, I listened to you during Power Monday, and I need my discount.
Yes. So the discount code is Power Monday.
Power Monday.
That means you will
Exactly.
go with 5,400 instead of 6,000. Thanks to Power Monday. Thank you very much, Dr.
Thank you.
Stuart.
Thank
Yes, so
you.
somebody is asking, thank you, that is Caroline. Can it be used in the treatment of psychosomatic symptoms? Well, these medical things are hard, yeah. Encopresis alongside psychotherapy. Thank you.
Liking this audience, yes, it psychotherapy, psychosomatic. Yes, and that's why chiropractors are trained very well. We have a 5-year program after your first degree, so you have to go to school for a very long period of time. Yes, some things are not really physical, some things could be psychosomatic, meaning there's something else somewhere else that causes the problem, and you just need to pinpoint it and make sure that you help your patient or point them in the right direction. So yes, that works.
Okay, good. Now, from Maurice Omondi, I think you also expected this question. Good morning. Do insurance companies or cover chiropractic, reflexology, or acupuncture treatment? More so in your clinic. Which
Uh-huh.
cases does the practice treat? And finally, how much? Well, that one you've said. How much on average does it cost? Yeah, but now,
Ah,
well, I think this one is more of which kind of sicknesses, and so how much on average does it cost would mean how many sessions somebody needs to attend to get well or something like that.
but Jenny, I'm liking this audience. I'm liking this audience very much. Yes, some insurances cover chiropractic, others don't. It just depends on how the insurances have aligned themselves. We do take a lot of the international insurances, Aetna, Bupa, Cigna, Allianz, lots of those we take in our clinic. We have opened up a conversation with the local insurance firms here. And what we do, you pay us, and then we fill in the forms, and you can claim from your insurance after you have paid up front cash, just because we don't like the following up and the fact that insurances take a long time to pay their providers. But they're open in the fact that if you come in for therapy, you fill in your details, your form, and you can follow it up as your insurance company because you're their client, and they're very able to pay you back.
Good. Yeah, I think we are coming
The number of
towards the end.
sessions depends on the condition that you're looking at.
Okay, great. Yeah, due to time, we will stop at some point. I will just pick maybe the next two questions. So the other one is from Ulembo, who talked earlier, asked a question earlier, I think so. That with all this, that is chiropractic, reflexology, acupuncture, with all that you people have to offer, why then do people still flock to India? Could it be the cost? Could it be the quality of work? Could it be that they don't know? What exactly would you say?
I would say all of the above.
Uh,
Because the fact that probably they don't know that we have good providers here, and the fact that probably we have a lot of people who don't give value for money in this country. But really, we need to make sure that we're doing things differently. We are looking after our Kenyans properly, and we are giving the best we can to all the patients that are here, so that there's no need to go to India for care when you can get it locally.
okay. Thank you very much. I think let me just read this one for June. It's fairly long. Asante sana tena sana daktari. Your journey has been phenomenal from physiotherapy to chiropractic and more. Does the activator vibrate? Yeah, does it vibrate? I remember the power vibe machine being quite helpful when I had back issues a while ago. I've seen 45-year-olds getting hip replacement and some horrific double knee, double hip were out living folk crippled. And she's given her contact there for people who may want to consult her for wellness, for supplements. So, does it vibrate?
It's it has a
And is
spring.
it?
It's spring loaded. It's a tool that is spring loaded. It gives a little bit of high frequency vibrational effect, but it's really a spring loaded stuff. So it's not. Hmm, good question, because the one I have is a manual one. There is one that you can actually put into the PowerPoint, and it gives a very high intensity vibrational effect. That one we don't have, but I've seen it being used elsewhere in the States. But what we have is a little manual tool that is very low intensity, especially, as I said, for those bones that are osteoporotic, and for children also who have soft bones or they're still developing.
Great. Thank you. I think we may end it there. Maybe we just, you can mention, I think this is important. Can a patient on wheelchair, 85 years with fracture, sick type, be helped?
A patient on wheelchair, 85 years with?
With fracture, sick, SIC types. I don't know what that means. I remember that is written in books to mean as written.
Well, let me tell you
but I
something
think,
about chiropractic. Chiropractic helps you get better, whichever. It's not like we're going to recover. If it's completely paralyzed, it's not like he's going to walk, stand up and walk, but it'll help him heal better in other parts of the body. So just making sure that the nervous system has got the ability to perform better, provide more flow to the other organs would be a big help. Not sure what the diagnosis was for that patient who's in a wheelchair with SI something, but it will make him or make her perform better in other functions of the body.
Thank you. Thank you very much. We'll end it there. We've really extended the question time, but I think it was worth it. Let's have Lady Noel. Come on.
That was such an insight. Like, that session was okay. Thank you so much. I do what? I concur with Wellness with Danjiro that indeed you're one of the best that we have. And thank you so much. You'll definitely be getting very many people from Power Monday. And remember, guys, when you go to her clinic, #Power Monday, you'll get your discount. You will definitely get your discount. Thank you so much. Now I call upon Mr. or is it Dr. Maurice Omondi to give the vote of thanks.
So thank you. It is Mr. I don't want to claim what I still don't have, but soon I hope to get it. But I really want to take this chance to sincerely thank you, Dr. Margaret Stower, for sharing with us about this practice, I don't know how best to pronounce it, chiropractic practice. And you enlightened us and gave us more information about it. I think many of us are from that school, which the one you talked about when you began. You go to a doctor and you want to be, injected and to be given some medicine, whether it is true medicine, whether it is just chalk, but you get out and you get ill. But I think as years have gone by, we've experienced more complicated illnesses coming in, and that is why I believe this chiropractic practice brings a solution. I don't know whether you call it chiropractic. I'm trying to get the vocabulary for it.
Chiropractic, but chiropractic, it's fine. Go ahead.
Yeah, but like you yourself making the decision to move from your previous practice to this and investing time in it means that you become a specialist, professional, and what you have shared with us is something which has really enlightened personally myself and even many other people. And we really, really appreciate. And even the discounts that you have given. Because I think one of the biggest challenges many Kenyans are facing right now is the cost of treatment, especially the cost of good treatment, and with insurance not working. So we really hope that at one point, this treatment will be covered by many local insurance companies because it is non-invasive and yet it can sort out a lot of problems. I also liked the analogy you say that a person is growing is just like a tree. And if you don't trim a tree, it can form. So it reminded me of this Kiswahili saying that samaki mkunje angali mbichi. Like you can bend a fish when it is still fresh and flexible. But the moment it dries up, it becomes very, very difficult. So thank you very, very much. And we look forward to having you again and again, not only in this session platform, but even in others. I hope you'll be able to attend the face-to-face meeting we'll be having, where you could even share with us much more. I'd also like to thank Paul Peter, the dream behind this dream together with Lady Noel. It is a very, very interesting story, how it all began, and it has grown to where we are right now. It is so big. And every Monday we have this session. Today we had almost perhaps more than 100 participants who joined, and the number has been oscillating between 80 and 90, just as a proof that this is something which is very, very critical and valuable to the participants. Thank you so much. Today we missed Dr. Lucita, our poet, but I think the way this program, in fact, when you ended very quickly, I was now telling myself, oh, everything has ended. Not only to see a floodgate of questions and the discussions, which has made the session very, very informative and very, very educative. I'd also like to thank all the participants who have spared their time to participate in this our Monday sessions. And we hope that whatever we learn here, we use it not only to charge our Mondays, but the whole week, and also to share this knowledge with other people. So without much ado, just want to say thank you again. Thank you very much indeed. And may God bless you, Daktari, and all the participants. Thank you very much.
Thank you so much, Mr. Maurice Omondi. Mr. Maurice Omondi is one of us. Like, he is part of Power Monday, not just as a participant in Power Monday, no, but he is Power Monday. He's one of the backbones of Power Monday. You see how the nervous system is? It's like a tree. He's one of the branches. I kid you not. So thank you so much. Thank you so much. Antonia, are you in the house? Now, just to remind you that you will be having a dinner on the 31st of October, 2025, and the theme is A Touch of Africa. Power Monday will be celebrating 5 years old, and as it is posted in the chat box, the early bird tickets are 3,500, and then if you're going to pay late payments, it's going to be 4,000 shillings, because remember, we have to give a number of the people that will be coming. And there's also an option for lipa pole pole, so kindly come, let us celebrate. We have very, very amazing speakers who will be coming on board on that day. And guys, Power Monday, we have powerful speakers. Antonia, are you in the house? If she's not in the house, someone to pray